You guys ready?
Yeah, let's do it.
Yes. Yeah. Can everyone hear me with the mask on? Okay. It's our first in-person event since COVID started. So.
Wow.
Yeah, it's pretty exciting for us. Yeah, and we thought we were going to be open inside by now, but we haven't. So it's all very fun. So thank you guys so much for coming and being with us tonight. For those of you who haven't been here, we're 100% gluten-free, refined sugar, soy, corn, peanut, legume-free, and 99% dairy-free. So, if you have any allergies outside of that, we can usually still accommodate it. This is just so fun because we normally have a whole calendar of wellness events that obviously we had to turn virtual, and we do everything from thyroid to detox to how to make kombucha to sex and nutrition to everything in between. I love saying sex and nutrition because whatever laughs. But there you go. See if you do. So yeah, so you can always check out our calendar events on our website or on Instagram. We are here tonight. I'm so excited. So I work personally with Dr. Sayana. She's my functional MD. So is that anybody else work with Dr. Sayana? Yeah, perfect. So she's been a long-time partner of ours at JBK Kitchen and has graciously done a number of different events. We've done mold and heavy we've done detox from heavy metals. We've done hypothyroidism, and tonight you're talking PCOS. Yep, PCOS. So she's a wealth of knowledge. Ask any questions. You guys have a format you guys are on top of. You can stop in and ask questions at any time.
Yeah, definitely.
It's very informal. Please jump in and yeah, enjoy. Thank you guys so much.
Thank you. And we can take this off when we're talking.
You guys can take it off right now.
Okay.
Yeah.
Cool.
Yeah.
We'll just take turns. Yeah. That's good.
Are they on?
Oh, the music. We hear it a little bit.
I mean, that's Brothers Bar.
Oh, it's all
Yeah.
Oh,
Yeah.
That's not too bad.
If for some reason, I'll let Corey know just not to turn it off, but it should be off. If you guys can't hear us, turn it off.
Yeah. We'll just, when each of us is talking, we'll just take the mask off. It feels so much better. So, something that I like to do, whenever we have events here, obviously we'll introduce ourselves, but I really like to kind of go around and just introduce everyone, just short, say if you want to talk about why you're here, or if you have a specific interest, then we can try to cater, for you. So we'll probably do it in the format that I'll talk first for, I guess we don't have that much time, but 15-20 minutes, and then Amber will go, and then Dana will go, and we can each introduce ourselves, I guess, at the beginning. But first, we can just go around, if you don't mind. Carol, you can go ahead and start.
I'm Carol, and I'm just interested in the topic all around it. I know it's a big health issue for a lot of people, so it captures my attention.
Hi, I'm Diana. I'm a functional medicine practitioner in Colorado Springs. I'm a friend of Amber's. She invited me to come tonight, and my specialty is mostly hormones and autoimmune, but definitely I get a lot of people.
I'm Allie, and I went vegan a couple years ago, so just interested in, eating better and making sure I'm nourishing my body, and had happy hour plans with this girl and saw this event and knew she'd be interested, so we came here instead.
Yeah, that's awesome.
I'm Georgina. Similar. She was like, this seems like something you'd be into, and I was like, yep. I just lots of health things over the years. It's interesting to figure out kind of the root cause of it all, and especially the environmental impacts. And so, yeah, just something I've always been interested in.
Hi, I'm Savannah. Just in Middle on my journey right now, but I've had family members experience their own health concerns, so I just started listening to that. So I'm all about educating, and I found a new path recently, so I'm just trying to add more knowledge to it. My name is Jen, and I'm just here to educate myself.
My name is Grant, and mold toxicity is an active part in my life, unfortunately. Not me personally, but I am in a relationship with Amber, one of the speakers tonight. So I'm also here not only to continue to educate myself and learn, but also to support my
practice me. That's awesome. He told me that you were coming. That's so great.
Serendipity. I said, look, I look gross. I've just been working out. He's like, just go.
You look great.
I'm not decked out or anything.
Okay, awesome. So, lots of different reasons for being here. I'm glad you're here. You know, hopefully it'll be a really interactive, fun discussion. So, like she said, you know, if you have a question, feel free to raise your hand, you know, or just say something. You know. So, like she said, I'm Dr. Sayana Rafacha. I'm a family medicine doctor, medical doctor by training, but I really found a major interest in functional medicine and integrative medicine early on. You know, I really just saw how regular medicine, it really didn't get people to wellness. It could, like, you know, help with symptoms, and it could help in times of acute need, emergencies and all that. But as we know, you know, if you're here, you probably know, like, the real true way to health is using a lot of different things like lifestyle, nutrition, and then looking for the root cause, which is what one of the root causes of disease is what we're going to talk about today, is toxicity. So, you know, there can be so many different things going on in the body causing problems to present themselves as disease, and this is just one piece of the puzzle. Usually, you know, talking to patients of mine, this will be like a screening question. You know, have you had exposure to like a musty or mold-ridden, you know, environment, or, you know, do you have mercury fillings? You know, that is certainly a question that we ask, and we do a physical exam. We look for that, and then when we do testing, it's always a screening. It's always a screening tool, and that we always start off by doing blood tests, you know, for lead and mercury, and just see, you know, is it something that comes up. I'm just gonna look at my notes, make sure I'm not missing something. But so I'm gonna be talking about heavy metals and some other chemical toxicities that I think we should all be aware of and learn a little bit about in terms of, you know, how symptoms can present, like how these toxicities can present themselves, as well as you know, testing and potential treatment. And then Amber will go into mold, and then Dana is an awesome, amazing patient of mine, and she's done incredibly well, and she'll just give you a little bit of the history and her story. So I just want to give you guys a little bit of facts in terms of chemicals in general in our environment, because it's not something we really think about every day. You know, we're just living our lives. You know, chemicals in our environment have so gradually increased over the past, you know, 50 or so years that we're not really noticing it. It's like this insidious issue that is creeping upon us, and unfortunately it's to the point where, you know, it's so insidious that you can't necessarily blame anything in particular on it, because a lot of these things are subtle, they're not being tested for, and they can cause issues like with hormones or fertility or immune system, where you wouldn't really go looking for that root cause unless you were, you know, someone like maybe one of our functional practitioners who's even like thinking about this type of stuff. You would just think, oh, you have infertility. Okay, well, let's treat that with XYZ medication. Or, oh, your immune system is shot. You know, let's just, you know, treat with antibiotics or something like that. It's not that, you know, people aren't really, unfortunately, conventional doctors for the most part are not really like considering this as a problem. So that's probably the main problem, is that it's not really in the forefront of like medicine right now. And, you know, there's a difference between having sensitivity and actually having toxicity. And what, you know, modern and conventional doctors think of as toxicity is like, okay, like you have acute poisoning from XYZ, like you took too much Tylenol, now you have liver failure, or you know, were exposed to lead, you know, in the water like Flint, Michigan, and that, you know, caused all kinds of problems. That was like an acute toxicity that was so apparent that no one could deny it. But the problem is that we are exposed to like tens of thousands of chemicals in our environment every day. Like 80,000, more than that, have been introduced into our environment in the past 30 years. So these are all chemicals that have not been tested for safety. And it's in our food. So, eating organic, this is definitely something that I don't consider just a fad. A lot of people are like, is that really important? They ask me that question, and it really is. Glyphosate is a pesticide that has been introduced to our environment over the past, maybe 20, 30 years. And by right now, at this point, the amount of glyphosate that has been sprayed in our world could fill 60 Olympic-sized swimming pools. Okay. That is so incredibly crazy. And this is a pesticide that was outlawed, banned in Europe because they know that it's toxic. So, and it's still being used. And it's actually, when you walk into a Home Depot, the first thing you'll see when you walk in is unfortunately something called Roundup. It's glyphosate, and you'll see it right there when you walk in. And people are spraying their lawns, and they don't really know what's going on. They don't know. And then, of course, their dog's going to have some type of problem because the dog's going to get exposed and all this stuff, And it's sad, but so glyphosate, that is really, really important. It's on a lot of our foods, specifically corn, soy, and beef. So as much as possible, we can't always get organic all the time, but those are like the main ones that are going to be like doused in glyphosate. And then there's a whole list called the Clean 15 versus the Dirty Dozen, and you can know like these are the ones that you really want to focus on getting organic, and those are made by the Environmental Working Group. A couple other things I wanted to point on. There was a study by the Environmental Working Group in 2005, and so that was 15 years ago, showing that babies' placentas, 10 babies that they studied, their placentas had 280 different chemicals at birth. So, this is an issue that, it's not like only accumulation over time, like in our lives, which is definitely part of it, but it's actually like being passed down. So it's something to think about, if you're going to be conceiving anytime soon. Obviously there's some young women here, it's something we want to think about, especially around that time, trying to detox our lives as much as possible. And there's a term that I wanted to touch on called endocrine disruption. So that's a fancy word for hormone dysregulation, basically, like making your hormones imbalanced. And there's a whole bunch of chemicals that have been studied, and actually the Endocrine Society has listed a whole bunch as being endocrine disruptors, as disrupting hormones. Some of them on the list are pesticides, flame retardants, which with the fires now and all of the, trying to contain these fires right now, so many flame retardants are going into our atmosphere. So, that's something that we're going to have to deal with. But
and when I was at the area, the places I went to regularly, it was super slimy. Like, it was like, down was like pulled like by the rocks. It was super slimy.
yeah, so so detox is going to have to be a part of our lives. Like, basically, like, it's going to keep our toxicity levels are just going to keep going up with all of this stuff. BPA, of course, that's been pretty publicized at this point. Everyone knows to avoid these plastics, and they are on certain receipts, like the glossy receipts, so you want to be careful about touching that too much. Just don't take receipts as much as you can. And BPA, I mean, it's interesting because it was actually known to be an estrogen stimulator. Actually, that's how it was discovered, and then they started using it for these other things like plastics, which, why that was a good idea, no one knows. Phthalates, also in plastics, these things are endocrine disruptors. So obviously, so now we know there's a lot of things, these are all omnipresent, they're everywhere. We can't really get away from them because even people in Europe where glyphosate's, banned, cities that have not had glyphosate present in their food for long periods of time still actually have glyphosate in their urine on testing. So it's in the air, we're breathing it in. So things that you can do, to try to prevent these from happening, we'll go through some of these things. Certainly sweating every day, that's something that I really try to encourage. Obviously with winter coming, it gets harder to get a good sweat in. Any way you can get to like an infrared sauna would be amazing. You know, there's some places in the city that have been taking appointments now, you know, to try to get people after COVID to still be able to use saunas. I know Jen has her sauna. We actually just got a sauna this week. So, you know, there's hopefully everyone has access to it in some way, shape, or form. Otherwise, just doing exercise, you know, some form of exercise, getting a sweat. I mean, that's such a beneficial way to detox from plastics, all the things I just mentioned, including heavy metals, including mycotoxins. All of these things come out in our sweat. All of these things come out in our breath even, you know, so yes, they can go in, but they can also come out. So doing like breath work, deep breathing exercises, you know, various people have different ways of doing it, but you know, looking up different apps like meditation apps, they can teach you different breathwork exercises. It's a really great way to detox as well. And then we can go over some other ways, of course, making sure you're pooping every day, drinking a lot of water, flushing things out. That is so important. If you're not pooping every day, magnesium is a great supplement to use. If you haven't explored that yet. I also, so before I run out of time, I just want to touch on heavy metals. The one that I see most often is mercury in my practice. Lead would be second, you know, close second. They're both pretty high up there, lead and mercury. Of course, there's other heavy metals out there, thallium, cadmium, aluminum. These are all also causing issues in various people. But mercury, you know, that is one that we're so exposed to all the time because one, I mean, we're being told eat fish, obviously, it's good for you. But not all fish are gonna be good for you because some of them are really high in mercury, and those are the big fish. The ones like tuna, swordfish, even sea bass, you know, there's a lot of really common fish that we eat, and they are gonna be higher on the mercury scale, so you can look that up, you know, there's different wallet cards like from the national database for you know, environmental services. You can look up their wallet card for low mercury fish, and I always go by the acronym SMASH. It's sardines, mackerel, anchovies, salmon, and herring. It's also like high in omega-3 fish, so you know you're getting more bang for your buck when you're eating those kinds of fish. But the common denominator is that they're small. They're small fish, so they don't have as much time to grow and accumulate all of the mercury in their lifetime. That's the main thing. Mercury becomes a part of the fish because they're living in the ocean, and actually industrial pollution is landing in the oceans and causing mercury to land in the water, and then the fish are absorbing the mercury from that. So it's not like fish just have mercury in them naturally. This is from our pollution that this is happening. So that's important. Fish. The second thing is going to be amalgams, you know, mercury fillings that people have gotten, you know, probably more than 10 years ago. I think they stopped putting them in around that time. But even you still get people in their 20s that have, you know, mercury fillings, and so that's something we always encourage our patients to try to get out, remove as much as possible. Of course, that can get really pricey, you know. There's
Very expensive.
yeah. There's sometimes you can work with a dentist, they'll say, oh, there's a crack, and like try to get it, you know, if you have dental insurance, maybe you can get it covered, but otherwise, you know, I've got patients that try to go to Mexico to try to get it super, you know, a lot more affordable. You know.
Yeah, I think I should.
Yeah.
Mercury and heavy metals, fish in the ocean has been around for a long time.
Yes.
As, you know, first thing heard of it. But lately, in the last couple of years, microplastics have become a big issue with testing and identifying. Are microplastics classified as a chemical pollutant or as a heavy metal, or are they being looked at and tested for someone in your profession in the human body?
Yeah, so there's a test that we do to look for like different types of plastics, but there's so many different chemicals out there. Like I don't actually know of a test that exists that like tests for all the types of different plastics there are. But we do a test through Great Plains Lab. It's called JBK Toxicity Event, and it tests for maybe 30 different types of chemicals. Not all plastics, you know, some from like air pollution and like car exhaust and flame retardants, you know, different things that are like the most common ones. So yeah, I mean plastics are not a heavy metal. You know, they're different forms of toxin, and so they're going to do different things. Yeah.
In terms of detoxing from heavy metals, you mentioned some of
Yeah.
easy,
Yeah.
accessible. EDTA and DMSA are well known. And
Yeah.
I've spent maybe too much time reading lots about it, forums and information, and a lot of people got very sick from doing it because I'm sure it wasn't done properly or so on and so forth. I guess what I'm interested in is do you have other avenues to help them exit the body? I know I have cadmium, lead, arsenic, and mercury from pesticides sprayed in my house every 3 weeks. We're on a bayou, so from 0 to 18. So I have that running around in here. And then my mom was a smoker, so I have high cadmium levels. So anyway, I'm just kind of like a Chernobyl, I guess. Anyway, no, but so I'm curious, are there other more gentle, more sane,
Oh, yeah.
in my opinion, sane ways to exit?
Yeah, absolutely. Definitely, yeah. I mean, so you mentioned EDTA, that's the one that most commonly used for lead, you know, and then the DMSA is used for mercury usually, but they work, you know, a little bit on both. You know, they can be really helpful for a lot of people. But yeah, the problem is when you're using these mega doses, I've definitely seen people have terrible reactions in the past. I mean, I don't do IV, I would only do oral. So I've never seen like a terrible reaction. And also, you dose it, you know, you don't dose it super high.
Can you do other things if somebody doesn't want?
Oh, absolutely, yes. So there's a company actually that specializes in detox that I really like called Quicksilver Scientific. Yeah, they have.
That's who tested me. Chris Shea, the owner, yeah. Who tested me and told me.
Yeah,
That was 8 years ago, but I haven't had
Oh wow.
the system, I don't
Yeah.
want to take up too much time, but so I'm trying to figure out how
That's very helpful, yeah.
to take those out without the EDTA.
For sure. So he has whole systems that he's created. Like he has a whole.
That's happened since I spoke with him.
Yeah, yeah. It's been a while since you spoke with him. He's
Yeah.
come up with so many different supplements since then, and it's awesome. I mean, he has these liposomal formulas, so you actually put them under your tongue and they absorb into your bloodstream directly instead of having to take a pill and like hope that things get absorbed in your GI tract. But he has what's called a push-catch system. It's basically 2 supplements. I mean, this is probably the most simple and most probably universal supplement combo that you can use for like any toxicity. It's called liver sauce. He names it. He has really interesting names for everything. So liver sauce is a part of it, and then you follow that up 30 minutes later with ultimate binder. And so the liver sauce has all kinds of herbs in it, basically like milk thistle, gentian, myrrh, alpha-lipoic acid, quercetin, lots of great nutrients that actually help your phase 1 and 2 detoxification in your liver to occur. Because a lot of times people who become toxic, like their mechanisms of detox are not working optimally for whatever reason. There's so many different reasons that it could be not working right, or there's an overload, you know, and you just need to really help gently get those out. So you start with like I think it's like a teaspoon. You take the liver sauce. It's like a liquid. Hold on your tongue 30 seconds, and then you swallow it. 30 minutes later, you take a binder, which is the ultimate binder. It has like charcoal and some other things like clay that like bind. Yeah, and then you eventually poop it out. The problem with binders for some people is it's constipating sometimes. So if that's something, obviously we don't want to deal with constipation when you're detoxing. That's like the number one rule. Like you got to be using the bathroom every day. So other binders out there that are effective and not charcoal based, I like to use modified citrus pectin. It's great. You know, it actually helps with using the bathroom, and you don't have to take it away from food, which is so convenient for people. I love that one. Saccharomyces boulardii is a binder for molds, less so for metals, and then chlorella is a really good binder for metals as well as molds too. And also, you don't really have to take that away from food. Doesn't mess with your bowel movements. So those are, you know, some really great places to start. I always like to support detox with vitamin C, magnesium, and alpha lipoic acid. Like they just open up the detox pathways, and glutathione. Those are probably like, you know, those are like the real like core support of detox. And then the things that, you know, of course can work for anyone, like the sweating, the breathing, the making sure you're using the bathroom every day, making sure your parasympathetic nervous system is activated every day, whether it's meditation or you know, being in nature, you know, whatever activates your relaxation mode, you know, doing that every day. So that's kind of, you know, obviously a huge topic. So that's kind of what I wanted to share with you guys today. And we'll, you know, take more questions at the end, but I want to take it away to give it to Amber.
Great, thank you.
Yes.
This is such a difficult topic to, these are all difficult topics to summarize in such a short time frame, but I think that was a really great overview that was super practical and helpful. So thank you so much. Yeah, so I'm Amber Walker. I have a business called Origin Wellness. I actually have some cards over there by the flowers. If you're interested in learning more about the practice, I'm a doctor of physical therapy by trade and have pursued functional medicine and nutrition certifications in the past few years, kind of complement the physical therapy side of things. And really my own patient journey drove me to pursue that, as well as just working, kind of like what Dr. Diana said, with a lot of patients who just, you know, weren't making progress with kind of the conventional or mainstream approach. We were kind of putting up band-aids on things, and so I was working with a lot of folks who had chronic pain, chronic fatigue, and fibromyalgia, and a lot of these labels, and became sort of disheartened with the system. So that really encouraged me to pursue this route as well. And it's been pretty incredible ride. I'm talking about mold today, and there's a couple of terms I'll probably throw around. So first I wanted to just check, has anybody here heard of mast cell activation syndrome? Right. We got several. Okay. So this year last year I put out a book about mast cell activation syndrome. Find it on Amazon if you're interested, but basically it's a very common but not very well known condition that affects a lot of individuals systemically. And so when I work with that particular patient population, I tend to see about 80% of those folks who have that condition come in and they've had a history of mold exposure. Even if they're not actively living in mold right now, they've had some kind of an exposure in the past. And it seems to be that way across the board. There are some naturopaths who also specialize in working with that condition and find that kind of 75 to 85% range of their patients have mycotoxins on their urine tests, etc. So this is a pretty big topic. I think is really important. It also goes hand in hand with something called POTS. You guys, anybody familiar with POTS? Or dysautonomia? So if we have time, we'll get into what all of these terms mean. This is really not the focus of today's chat. It's more just focused on mold. But another common condition that we see that tends to go hand in hand with mold, and the third that tends to go hand in hand with all of this, is something called Ehlers-Danlos syndrome, which we see a lot of in PT, actually, the hypermobile type. So, well, if you guys have questions specific to those three conditions, I'm happy to chat your ear off about it later, but probably won't have time to get too in depth on those. But mold is really a big deal. It's very common. Has anybody here lived in a moldy home? All right. Well, I thought there'd be more of you, but that's great. Sometimes, or perhaps you weren't aware. Yeah, perhaps you weren't aware that you were living in it. It's not always that big black blob on the wall, right? A lot of times mold is hidden in building materials. It's not visible to the eye, but it can still make us sick. There's actually some interesting statistics about mold. So I'm going to do a little trivia for you guys. And let's see, I didn't bring any prize. Actually, I have handouts over there, so if you get trivia right, you get a free handout. How's that? So what do you think the prevalence of mold is in homes, residential homes? What percentage of homes would you say currently have mold in them right now at this point in time? Any guesses? Ballparks?
I've heard as high as 40%.
Okay. Going up?
I think I've heard 60.
Yeah. So the studies that I found on this topic, looking at the last last 20 years of this question have found between 43 and 68% of homes actively have a mold problem right now at this point in time. That's a lot, I think.
There's a window on the side if you want to.
What about lifetime prevalence of mold? So, if we take one building in its entire life, what's the prevalence of what are the odds that it might have mold? Guesses?
100%. 100? Yeah, I think so.
I think that could be accurate. The studies say 85%. So, now mold is not just a problem in old buildings. Unfortunately, I'm kind of a mold magnet, and literally today we moved because the house that we moved into 9 months ago had a roof leak, and it was a brand new building, brand new, first people in there. So no building is immune. Learned that one the hard way. Also, never go for a flat roof. Never go for a skylight. There's a lot of tips, practical tips I can share with you guys about trying to select buildings that may be less likely to have mold too. And there's some great handouts I have on that I can send you if you're interested in learning more about the prevention side. So what do you think, how long does it take mold to grow after water damage? Let's say I have a roof leak start. How many days, weeks, months, when does it start growing? Anybody know?
It's days.
It's 24 hours is what they found, 24 to 48. It does not take long. So that means if you go away for a weekend and something starts leaking and you come back, there's a good chance you could already have some growth there. So just keep that in mind. Now, humidity does play a role, but it's not the only factor. A lot of people say, oh, we're in Colorado, it's a dry state, I don't have to worry about mold. That's actually not true. But being in higher humidity does play a role. Any guesses to what percentage of humidity spikes that mold rate, Chris?
100%.
So 50% humidity and higher, you're going to have quite a bit more risk of having mold just naturally form in buildings. But it can be 0%, you can still have it. So, now what percentage of humans get sick from mold? I'm doing a lot of number questions today. Hope you guys like math.
Like 30 or something like that.
Approximately about, they say, 25 to 30% of humans are affected by mold, and a lot of them are unaware of it. There's a genetic mutation called an HLA-DR that affects about 25% of the population, and that renders individuals unable to actually take those toxins in our body that come from mold and remove them the way we should. So normally we should pee them out, they should go through the gut, and we should poop them out, sweat them out. But there are about 25% of people that physiologically don't have the ability to do that without some kind of help. Those are the ones that are going to get sick, and that's why a lot of people can have a family of 6 people in one home, and maybe only 1 or 2 people are sick, or in some cases the whole family is sick. It really depends on that genetic piece. Same thing with the workplace. A lot of folks get sick in their office, their workspace, and their boss is fine, their colleague who has a desk right there is fine, and they're like racking the brain, like, I don't understand, why am I so sick here and these guys are fine. And it does come down to that big genetic piece. Now, I don't like to blame a lot of things on genetics. I think there's a lot of environmental factors we can work on too, but when it comes to mold, that does play a big role. And you can actually plug in if you've done any of the commercial, like the 23andMe type genetic testing, you can actually plug in your raw data into a website and look up whether that HLA-DR variant is positive or not with your genetics. So if you've ever done that testing and you're just curious, you can look that up pretty easily. And then of course there are more reputable tests that can look at that as well.
What are some of the common symptoms?
The common symptoms? Wow, that is a hard question to summarize. I mean, a lot of people think respiratory issues, itchy eyes, sinus problems, headaches, fatigue, skin rashes, and those are all symptoms that are commonly encountered. But for a lot of people, there's also a lot of neurological symptoms that will happen. Some patients will get seizures or like different types of tics or spasms that will occur. A lot of individuals have insomnia. It's a pretty hallmark symptom as well. Neuropathy, especially at night. Burning hands and feet at night is one of the classic things I see in a lot of my patients who are having mold issues. muscle weakness, anxiety, depression is huge. So mold, I call it the personality changer. It can have a huge impact on just your well-being, how much anxiety you're experiencing, depression, all of the above. It can be pretty profound. A lot of patients will also complain of weight gain and connect that to mold. A lot of joint and muscle pain. We'll have patients come in that are just, lots of joints inflamed and they don't know why. We look at dizziness, POTS or dysautonomia, where the heart rate is fluctuating with changes in your body position. A lot of people also will faint or have orthostatic changes when they stand up. They'll get lightheaded for different reasons. And then some people also have a lot of numbness and tingling or like strange, either sudden like kind of electricity pains or kind of pit-like pains, sharp pains. Dr. Neil Nathan wrote a book called Toxic, which I highly recommend. And it's actually holding up our phone right there if you want to look at the cover of it. And he also talked about some hallmark symptoms of mold being kind of unusual stuff, like the tendency to get frequent electrical shocks. I know when I'm living in mold, I will get shocked by anything and everything, and I can't even ride my bicycle because every time my leg touches the metal, shock, shock, shock. So there's a lot of unique symptoms like that can happen as well. People also report a metallic taste in the mouth that's been connected to mold. Mood swings, a lot of folks have sweating issues or temperature dysregulation problems that they associate with mold. And also, a lot of people kind of find that they're constantly thirsty and they're constantly having to pee. That's another common one.
It's like all over the board though. That's so hard to.
And then the gut. The gut's huge. I haven't met a person who's been affected by mold who has not had really severe issues in the gut, to be quite honest. That's kind of across the board usually tends to happen, at least in my experience. I don't know if you've done that as well. So it can really affect the whole body pretty severely. Now, it's not to say that mold is the root cause of everything. A lot of conditions can cause those symptoms. So it's really important to work with a functional provider who understands and looks at the whole picture and puts all the pieces together. Hope that answered the question. Kind of a long-winded one. I had to read off of this because there's so many symptoms. But essentially what happens on a physiologic level is these mold toxins are lipophilic. So basically they have these fatty acid molecules, and so the toxins, they kind of migrate and get deposited in the brain. And that's why we see a lot of those cognitive changes, a lot of brain fog, personality changes, fatigue, that kind of thing going on, as well as the effects on anxiety and depression. So the toxins can definitely affect our hormonal production as well, so I tend to see a lot of that going hand in hand with the mold issues too. Now, let's see, a couple other notes. So I guess, one of the main things is how do we test for these, what we call mycotoxins, or the toxins that are the byproduct of mold? How do we test for that in humans? Any guesses how we find these?
Do a hair. I think you do a hair test.
So typically hair is used for heavy metals sometimes.
Sometimes.
Yeah, kind of controversial. But typically for mold, what we'll do is we'll do a urine test. And sometimes people will do blood antibody tests as well. I'm more partial to the urine, and that's what I found in the literature more, is the urine test. There are two different labs I'll use for that. Great Plains Lab is one of them, or Real Time Lab. They both have urine tests. You do it first thing in the morning, and you have to be very specific about the days leading up to the test. There are certain supplements you should be taking to help. Because the irony of it is the patients who are very sick from mold often have negative urine tests because they literally can't remove it even in their urine at all. It's just stuck in their system. And so there are certain things like the sweating, the sauna the morning before you do the urine sample. There's certain things you want to do that are outlined in my handout, as well as in Dr. Nathan's book, that can really help the urine test be as accurate as possible for you. And urine testing is important. It's not just enough to know what's going on in my home, but you want to know which particular species of mold might be more of an issue for you, because that will kind of guide which toxin binders you might focus on, and that will guide which treatment approaches you go toward. So it does matter. Tests are a little bit expensive. There are other tests out there that a lot of providers will do, just kind of looking at inflammatory markers for some of these biotoxin pathways. And then there's also a test called the Visual Contrast Sensitivity Test, which is found at bcstest.org, I want to say, or .com. just Google BCS. It's not diagnostic, but it does help you have an idea of whether a biotoxin might be impacting your system. It's a $10 test. You take it online, you set up the computer screen, and you kind of go through, and it's essentially looking at the function of the optic nerve. And they found that the optic nerve is quite often affected in folks who either have Lyme disease or mold issues. So again, the test is not diagnostic. It's not to say you definitely have a mold problem, but it gives you a great printout and some nice information you can take to your provider. And it's a test that's cheap and easy online that you can kind of do later on down the road to see what kind of biotoxic load do I have right now. So that's a nice intro. Usually I'll have people do that as a screening before we go for the more expensive urine tests. Kind of gets their buy-in when they see those numbers off the charts and they're like, oh, I didn't realize my optic nerve was so inflamed. Kind of pursue the other route. And then, sometimes people do get what we call Marcons, which is a type of a staph infection in the nose, the sinuses from mold. So I don't know in your experience, in my experience, maybe 10% of patients go through the mold treatment and they're still not quite better. Then they might need to have that additional testing of the sinuses. They might have to have a swab done to determine if they need some specific nasal sprays to help address nasal mold colonies. So that's another part of the testing that sometimes occurs, but it's not usually done right away. It kind of depends on how you do the treatment. Is that good experience too?
Yeah, and also specifically if they have a lot of sinus symptoms, then I'll definitely do it.
Okay, yeah. So kind of depends on the person. Yeah. And then how do we test for mold in buildings? Well, I could talk for a whole hour on that. I won't. But I've had some unfortunate recent experience with that that Graham can attest to. But in terms of testing in buildings, it's very controversial. You're going to find a million mold companies out there, here in Denver, everywhere, that say, I'm mold certified and I know what I'm doing. And they're going to walk in, and I've seen it all. We had one guy who said, oh, you don't need to test, just open the window for a few days, you'll be fine. And then there are folks who do the air sampling, and they compare samples of outdoor toxins to indoor, but the problem with that is it's one snapshot in time. It's really not going to give you an accurate picture. There's a lot of things that affect the air and the spores that are in the air. So really the gold standard across the board is dust testing in homes. Now, there's a few tests that are quite expensive that are very helpful for the chronic illness community. There's one called the ERMI, which is the Environmental Readiness Mold Index. And then there's the HERTSB, which is kind of like the little sister that's a little cheaper but a little less thorough. And so those are kind of the best tests, especially if you suspect, like, okay, that bathroom has an issue, I know it does. Then you might want to target, your more expensive test to that part of the house. What it does, the ERMI looks at 26, I think, different species of mold, and it looks not just on how many species you have, but also the quantity. And then it also looks at types of molds that are kind of common in homes that aren't as toxic to our health versus the types of molds that are very toxic to our health. It gives you this whole report and a whole score. So based on the score, you can decide, do I need to tear open the ceiling and investigate this? Is this really affecting their health? Now, the ERMI is a lot more specific to patients who have what we call CIRS, which is a CIRS. It's a term for basically a chronic inflammatory response syndrome that is caused by biotoxins. And so Dr. Schumacher is the creator of a website called survivingmold.com. Highly recommend that. Incredible abundance of literature there to look through. He's done a lot of studies. But basically his perspective on the ERMI is if you have a score of 2 or higher and you're kind of susceptible to mold illness, then you need to do some remediation. And so it's helpful for making that decision. And it's also helpful for retesting after you've had a company come in and work to make sure that you're safe to move back in.
Roughly how much are you talking in terms of that test?
About 500 for the ERMI for one sample.
So that's like one room, you mean?
Yeah. And then about 300 for the HERTSB, which is, the HERTSB only tests like 6 or 7 species, but it's still the same kind of technology, still spits out a score for you that you can use. The scoring's a little different on the HERTSB. The 2 only applies to the ERMI. So,
What do you think about the Petri dish?
so there's more Petri dish tests coming out, and there's a lot that you can find like at the hardware store. I don't recommend those for over-the-counter ones. There's a company called Immunolytics,
That's one, yeah.
which has a better reputation for Petri dish testing, and those are going to run you about $35 per sample, per room, essentially. And so if you're looking for the budget way to just kind of get a feel, that's the way to go. I actually know a naturopath who tested over 200 homes with immunolytics testing before she found one that was mold-free to move into. So that adds up fast. So when you're looking to move, it can be really overwhelming. A lot of patients who are sensitive to mold can make a tremendous recovery of the right approach, but they might always find themselves sensitive. So like for myself, being a sensitive individual, when we lived in Seattle, I'd walk by a building and I just know, or I'd walk in and I just know within seconds my body was that sensitive. I was like a human mold detector. That's gotten so much better now that I pursue functional treatment, but it's still there a little bit. So, it's something that can definitely be treated. What the treatment is typically removing the trigger. Obviously, you have to get out of the moldy situation. In some cases, that means getting rid of belongings. There are more companies that are starting to use fogging machines and other things to try and treat your belongings, but it can involve getting rid of everything that's permeable, clothing, books, papers, furniture, etc. Just depends on the severity of the case and what, kind of individual factors, but a lot of patients do find that really helps. Toxin binders that we already got into some of the toxin binder options for the heavy metals, and there are a lot of broad spectrum toxin binders that will also bind mold, and there's a few others that are specific, and again, it kind of depends on what's showing up in the urine as to which route we would go toward for that. And then just supporting the whole system, and you talked about ways to just support detoxification. A lot of the patients I work with do not tolerate supplements very well, and so we do a lot of work with the nervous system, with kind of energetic healing. Looking at spiritual and emotional toxins as well as physical toxins is really important. We do a lot of work on sleep hygiene, which is really huge with folks suffering from mold, Lyme, etc., things that affect the nervous system. We already touched on sweating and hydration and some of these other lifestyle factors. And then working on the nervous system, there's different programs out there that can help you restore kind of that rest and digest. If you're in a home that has these toxins, these mycotoxins that you're inhaling, and that's usually the way we're exposed is in the air, although we do have mycotoxins in foods as well. Absorb them in your skin as well. But a lot of these folks, their nervous systems are either in just like fight or flight all the time because they're constantly having this trigger, or some of them are in actually a state of kind of like a crash state where people are just almost like in a frozen state, which can be equally detrimental. And so kind of working with meeting the nervous system where it is and trying to give it tools to help that individual reset, and in turn to not have this sort of limbic system reaction every time they're exposed to mold, because that's a big part of this too, is learning how to retrain and rewire the brain to move forward, recognizing that it's a toxic substance for them, but also finding a way to not have it trigger you into a huge stress reaction and a flare every time. Because it's inevitable. You're going to walk in a grocery store, you're going to walk into a building and find mold, and so finding ways to kind of cope in that regard are really helpful too. The only other resource I have for you guys, there's a book called Through the Shadowlands by an author called Julie Raymeyer. I know her personally. She's incredibly brilliant. She's a scientific writer, but she talks about her patient journeys through mold. Have you read it? Through the Shadowlands. Yeah, Through the Shadowlands. I thought it was a fascinating read, and it really showed kind of a great story about her experience and her process and healing from it. So that's another great resource. Your book? Sure. Yeah, my book is called Mast Cells United: A Holistic Approach to Mast Cell Activation Syndrome. It's kind of a mouthful, but essentially, if you Google, it's on Amazon. If you Google Mast Cells United, there's an e-version and paperback. But it took a couple of years, basically, kind of looking at more of a holistic approach to the syndrome, which is essentially the mast cells are cells that trigger what we know them for is histamine, right, or allergic reactions. But they can trigger, they release about 200 chemical mediators that can trigger symptoms all throughout the whole body. And so, the mainstream approach is these mast cells, are dysfunctional and we need to medicate them. And the book kind of goes into those options, but then kind of expands into the holistic realm of how can we get to these root issues through these functional type testing and nutrition to reverse the inflammation in the system. Okay. Any questions about mold? Great. Cool. Well, I'm looking forward to hearing from Dana.
Okay, so you guys went into Hi, my name is Dana. I'm here to talk to you about my experience as a patient who has the trifecta that you talked about. I have mast cell, I have POTS, I don't have Ehlers-Danlos, but I do have hypermobile spectrum disorder, which is very similar, a connective tissue problem. I got diagnosed a year ago. I've recovered incredibly since. If you were to see me a year ago, you would not have recognized me. Update, I didn't recognize myself. That I think speaks to this whole situation, whether or not you're susceptible, whether or not you have an underlying condition. Environmental exposure is it's invisible in a lot of ways, and I was gaslit by most of the doctors I've had my whole life, saying that I'm hypersensitive, I'm being dramatic, no, you're lying, you're attention seeking, all of those things, and boy were they wrong. So I was a competitive swimmer growing up. It turns out probably spending most of your foundational years, hours a day in a pool, chemical vat of water, chlorine is a big trigger for me. So I've had toxin exposure throughout my whole life, but things got pretty severe when I moved to Santa Barbara in 2013. I went to school at UC Santa Barbara, which is a great place, but it is covered in mold. And I noticed my first symptoms were respiratory. I was training for a marathon and I had asthma and I couldn't breathe. So I saw a pulmonologist and they said, you have allergy-induced asthma, here are all of the things. So I did all of those things. And then I started getting UTIs all the time, nonstop. And then so I saw a urologist and they're like, here's nitrofurantoin, take it after intercourse or take it anytime you are getting a UTI. And so then I was constantly kind of doing this antibiotic thing. And then I went to the eye doctor at Student Health because I was like, I can't see the board, I'm having issues, something's wrong. And they tested me and they were like, you have 20/20 vision, it's a non-issue. I didn't have the vocabulary at the time to say I'm having issues with contrast. And so over the years, things stacked up. I started having panic attacks. I've always been an anxious person. I've never had formal panic attacks. So that kind of built up in college, and it got to the point where I was seeing so many doctors, I was taking so many things, and I was just like, I'm a crazy person. I was like, I'm just like absolutely insane. There's the psychological aspect got really intense, and I had a lot of like hypnagogic hallucinations and dysphoria. And so I then actually kind of like fully pivoted into like, you are actually a crazy person. And that was really complicated to kind of arrive there at 21. I'm graduating school. I'm very unwell at this point. I've gained like 40 pounds. I was always quite thin growing up, and it just kind of kept coming. I had a lot of issues with dislocating my knees, which was really, I'd never dislocated any joints before. And then as my mold exposure got worse, I don't think this is medical community knows as much about this, but as I got sicker and sicker, and as inflammation built up in my body, my connective tissues, were not functioning the same way, and my skin got so sensitive and so easily broken and fragile that I just I thought half of it was in my head, but then I would see it happen in my body, and that was crazy. So when I graduated, I moved back here, and I started working at a tech startup. And eventually got to the point where I had to leave my job because I was falling asleep on my commute to Boulder. On the highway, just like full nodding. And that was the beginning of my journey into functional medicine, where I saw a neurologist. They thought I had narcolepsy. And they did 3 sleep studies. They were all so messed up that I couldn't stay awake during the day, and the way that they would test, I was very aware that they were not accurately perceiving me and perceiving my symptoms, and they had no clue what was happening. And so I made a pivot into a functional kind of psychiatrist, I guess, who eventually introduced me to Dr. Facha. And from there, we were really able to see what was happening to me, and it was the toxicity. So I had heavy metal poisoning, and that was from a copper IUD that I had. Probably, and then I had so much mold. I think when we got some of the results back, it was not it was off the charts in a literal sense. They could not even test how much mold I had in my body, and you could see it in my face. I was so, the weight that I had gained wasn't adipose tissue deposit. It wasn't like a fatty deposit. It was like every part of me was like blown up by a balloon, and you could just like see it in my neck, and you could see it all around. So it was really a process at first to we knew that I had toxicity, and then we had to figure out what was the underlying reason why it affected me as opposed to like the people that I lived with in college. as severely. A lot of people had acute symptoms at the time. Once we moved out, they stopped having sinus problems and things like that. And so it was kind of this piecemeal of like taking it one step at a time, figuring out where it all happened, or this component is relevant here. But I would say last fall, we had already started detox. I was so sick to the point that it wasn't like, like go exercise and sweat. I think that was a really big concern, that in detox you're exposing yourself. You have to re-expose your system to the toxins. So if they're stored wherever in your body, in order to get them out, you kind of have to re-expose yourself to it. And so it was a kind of a debilitating time for me. And I had to, I was taking so many supplements. I was, took all of these things, and eventually I kind of started to see progress. And last fall was when I really started to see progress, and I was able to kind of start picking the pieces and putting them back together. You mentioned both, physical therapy, which was huge for me. I think in my detox, I took a lot of the meds that are pretty standard, but what I found the most effective was actually like golden berries. They're these very tart kind of tomatillo type things, and they're tart, and they make you salivate. And we would take those, and they're known for detox. I would take those, and then later at the appropriate time we would take charcoal, and then just through like saunas and stuff like that, we were kind of slowly able to get myself to the point where then in 2 months I lost almost 30 pounds, which I think is scary, is absolutely terrifying. That's not a healthy rate to lose things, but it made me feel more comfortable knowing that I wasn't really fat. It was really like, my stool was neon green liquid, if that gives you any insight on what detox is. It was literally like inflammatory fluid leaving my body. And I coupled that with rolfing, which was huge, especially for anyone who has any sort of connective tissue stuff. That was really big in like moving the toxicity out. And I had always been pretty aware my whole life of like, I was a good swimmer because I have POTS, and so being horizontal is really, I can be a good athlete there, whereas if I'm like up running in an orthostatic position, I guess, my circulation isn't as good and stuff like that. So I kind of was able to piece together different parts of my medical history to kind of paint this whole picture. And another really important thing was putting my brain and my body back together. And I grew up horseback riding, and that was, it's therapeutic in a lot of respects, but also for me, it was really, really important to be able to feel and sense and respond in a really small scale way. And doing that with a horse, there are a lot of other ways you can do it, but I kind of looked at my history and I was like, oh, horseback riding was good. That's a really good way to also kind of, the limbic response, I think, is really important. Horses can sense and feel any sort of change in your kind of baseline stress level. And so being able to kind of work with myself to respond to that and kind of rebuild is huge. Last thing I would say is therapy is really important, especially if you're someone who has been gaslit or told that what you have is not real or any of those things. Therapy to work through kind of all of that, learning to trust yourself again, learning to trust doctors again. I think that was a really big part for me. I'm really pretty skeptical of a lot of mainstream Western medicine now, because I've seen the other side, and I've seen doctors who do personalized approaches and who really kind of see you for your whole system as opposed to treating symptoms. And so therapy is really big. I think that one of the scariest things was the psychological effects that happened with toxicity. That was, I had incredible personality changes. I'll take some ownership. I was partying in college, Santa Barbara, it's what you do there, and that's not a sustainable lifestyle. Certainly not enough to cause this on its own. And so I think that was, my subconscious was incredibly toxic, in that my body was toxic, but also kind of the way that I had worked myself around this, and the lies that I had told myself about what was happening. That was crazy. And with detox, there was a lot of psychotic moments. I would say, not like actual psychosis, but a lot of hallucinations and hypnagogic sleep paralysis is also what we'll call it. The sleep issues were really scary. That I think was actually frightening. It's not just like, oh, my body's shutting down, or oh, like things are changing for me. It was your reality is changed. And so that's spooky, but I'm thankful to have recovered. I think having a doctor that you can talk to about things and that you can say, no, I'm not going to try that. I think a lot of times I'm like, no, I'm not going to do it. And then we have to work on something a lot less efficient. Yeah. I guess, does anyone have any questions? I have a little more to say, but...
I'm curious if your POTS symptoms get gotten better as well.
Yes. POTS I have always had POTS. I think we didn't really think of it as a thing when I was a kid. Just my mom, just like every time I would stand up, we would just like, if I felt faint, if I thought there was going to be syncope, I would just drop to the ground. So it was kind of something that I like trained myself and I built myself to do. And I realized that wasn't normal for people, and the POTS got so much worse in college with the mold exposure. And since I've done something called the Chocolate Protocol, which is all about horizontal exercise and cardio, and that's been really big for me. So I do rowing, but that's a lingering symptom, I would say. I see it kind of in arm strength. I think when I think of my POTS, the way that I can see it lingering is in I guess I don't know. When I always think about it in arm strength. When I can do horizontal things, but it's really about circulation, and so it depends, and it changes seasonally as well, and so that's something that I'm kind of working on, and I'm certainly not back to where I was pre-college. I would say I look kind of like I did when I was 18, but there are, I have acne is huge right now. A lot of kind of, the subtler parts of POTS are still in me.
And did you, by chance, have a lot of head injuries riding horses as a child?
No, but I did have one swimming. So I had a pretty severe concussion when I was 10 years old.
Was that prior to POTS?
No, I would say that I always had the POTS before, but I've had a loaded health history of just like thing after thing after thing. You have this injury here, you get exposed to this, and so it really built up.
Did you feel like you had mold exposure before Santa Barbara?
No. The mold exposure in that specific area of Santa Barbara, it's a town called Isla Vista. It's kind of like a student ghetto. You have essentially like 18 to 25-year-olds crammed in this like square mile, and the property managers there are really problematic, and they own this incredible real estate, but they shove 15 people into a house with 4 bathrooms and 4 bedrooms, and your microbiomes are all up in each other's business, and it's really I could see I had a pair of shoes like this, they're wood on the bottom, and the mold was growing on the wood, and there's mold on the shower curtains, so that was really visible to me. But everyone in California just kind of acted like that was normal, and I was like, I'm from Colorado, it's really dry, like this is just what happens when it's humid. And I had but it did continue in my work in Boulder, and so that was, I did have a lot of exposure. It's not just that my body reacted the way that it did, I had consistent, frequent exposure.
Thank you.
Was that too fast?
That was great. Yeah, it was so good. So, I missed the first part, but I just want to say thank you for sharing so openly.
I mean, if I can take this opportunity to say something else, this has been a really expensive process, and I'm quite lucky that I have generational wealth that has allowed for me to move back. I used to live downtown, and I had to get out of there because the air quality is so tough. And so I live by Observatory Park in my childhood home, and I ended up needing a water filter, and I think that's been one of the biggest things that's different for me. I was so rashy, I was so high on my skin all the time. I think that that's more related to, it's still in response to like industrial chemicals, but it's a little bit more related to the mast cell, and probably the connective tissue stuff. It's really expensive, and when we talk about environmental exposure and environmental toxicity, a lot of that is actually done to marginalized communities purposefully, and so you can see in a lot of ways that like industrial production plants are localized to communities that don't have the funds to recover and don't have the funds to then make noise about it after. And so I think a lot of you, when I was kind of like, I was gaslit, I saw a lot of people not, and I think that that's a really systemic thing, is that we're not aware of the problems of this current time on a mass scale, and part of that also goes with so much of this is related to really the environment and the way that we treat and process all of the things that we do. And so vote, really believe in the climate crisis and understand that industrial practices are really and truly affecting you right now, even if you can't see it.
So true. And actually, just to say one quick thing off of that is on Netflix, there's a documentary that just came out called Kiss the Ground. Fantastic. It's kind of on that topic of how can we affect, with ourselves grassroots, how can we affect climate change, and it's about regenerative farming and the soil and everyone's watching.
Yeah.
You said you had POTS from, I guess, birth,
Birth,
very
yeah.
young. Did you ever discover the underlying cause of that?
So my familial history is, a lot of people are kind of postulating that mast cell is pretty epigenetic, and I think that that's a really interesting way to think about it. My father died from colon cancer when he was 44. I was 6 years old when that happened. And so not only do I probably have his genetics a little bit, they think that was environmental exposure. He grew up in Wyoming near an industrial fossil fuel extraction place. And so I have that, but on top of it, I think that emotional trauma is really huge. While I was at Santa Barbara, there was the Isla Vista massacre, which was a really traumatic shooting, and all of these extra things that piled on to my own personal emotional stress, and that really, it takes a toll, and your body produces the toxins the same way. So even if it's not an external stressor that you're like, oh, this is causing these, it's like, that was really huge. And so I think that it's a combination of my epigenetics, or I guess my family's genetics, and then growing up having lived a life that some of which is pretty traumatic. Yeah. Cool. Thanks, everyone.
Can I ask one other question?
Yeah.
What are you going to do to change the world with what you know now?
So I'm a science writer, and I work mostly in climate and ecology, which is pretty exciting. Right now is a really important time to be putting any scientific literacy you have to work. I think that if you have any ability to talk to people about the slightly more complex things that are so prevalent, whether it's in a political realm or, just, I'm writing a lot right now. You can see some of my work in the Colorado Sun if you're interested in that. But yeah, it really, being frank and honest, if I can recommend a book to you all, something called All We Can Save, and it's amazing, and it is a scientifically sound book, but it also incorporates poetry, and it kind of is on this concept of ecofeminism, and it's a really interesting way to look at how the solutions to the climate crisis are being led by women and led by femme people, and so much of that is related to not only toxicity and air quality and things like that, but just the way that we produce and consume. And so educate yourself and talk about it, and understand that no one can do it all themselves. We don't need everyone doing the same thing. We need people doing what they can, and we need people in their niche making change there. And one last thing, the great thing about climate science or climate justice is that it's so intersectional. And so, there are a lot of ways, like specifically people in the medical field or in health and wellness can incorporate climate justice into their practice, but there are also any industry, any discipline. It's really about how you do things, and so there's always a conversation to be had there. Google's great.
It's All We Can Save.
All We Can Save by Ayana Eliza, I think. Yeah, who are the authors?
Yep, Ayana.
Yeah.
Johnson.
Yeah.
Okay.
Oh, Ayana Johnson. I know her Instagram handle, which is so. Thanks, guys.
Does anyone have any other questions?
Thanks for coming.
Thank you guys so much.
Thank you.
I actually have a really random question.
Yeah.
I tried to switch to using